Millions of people take this pill every single day for the rest of their lives. The FDA label warns it has a narrow therapeutic index, meaning the difference between the right dose and a harmful one is smaller than most people realize. And almost nobody knows what too much of it does to their bones and their heart over time. There is a small gland at the base of your throat. Most people never think about it. It weighs less than an ounce. But it controls almost everything. Your energy, your weight, your heart rate, your body temperature, your mood, your memory. That gland is the thyroid. And when it stops producing enough hormone, a condition called hypothyroidism, everything it controls starts to slow down. Fatigue that will not lift, weight that will not move, cold that goes bone deep, a brain that feels wrapped in fog. For millions of people, the answer to all of that is one small pill taken every morning. Levothyroxine, sold under the brand name Thyroid, among others. It is one of the most prescribed medications in the United States, consistently appearing in the top 3 for over a decade. It replaces the thyroid hormone the body is no longer making enough of. And for most people, it works. But here is what makes levothyroxine different from almost every other medication covered on this channel. Most medications are prescribed for a condition that is expected to resolve. An infection, a period of inflammation, a temporary imbalance. Levothyroxine is prescribed for a condition that, in most cases, never resolves. The thyroid does not recover. The prescription does not end. And that means something very specific. Whatever this pill does inside the body, it does it every single day, for years, for decades, sometimes for the rest of a person's life. The FDA label for levothyroxine contains a phrase that does not appear in many other drug labels. It describes levothyroxine as having a narrow therapeutic index. That is not a technical detail to skip over. It means the gap between the dose that helps and the dose that harms is unusually small. A little too much. And the body starts showing signs of having too much thyroid hormone. A little too little. And the hypothyroid symptoms return. The window is narrow. And getting the dose exactly right and keeping it right as the body changes over years requires ongoing attention that does not always happen. The label warns directly about the consequences of getting that balance wrong over time. Too much levothyroxine over months and years affects cardiovascular function. The heart begins to beat faster and less regularly than it should. Palpitations, fluttering or racing sensation in the chest become more frequent. Irregular heart rhythms develop without an obvious trigger. In older adults, atrial fibrillation, a potentially serious heart arrhythmia, where the upper chambers of the heart beat chaotically, is listed specifically as a risk of overtreatment in the FDA label. This is not a theoretical risk. It is the most common heart arrhythmia associated with levothyroxine overtreatment in elderly patients, and it is written directly into the prescribing document. Most people who experience occasional palpitations while on this medication attribute them to stress, or caffeine, or simply getting older. The possibility that their thyroid medication dose is slightly high and has been slightly high for years is almost never the first explanation considered, because nobody told them to consider it. If someone you love has been on this medication for more than 5 years and has never had their dose rechecked, stay with this. What comes next matters. The second consequence the label warns about is bone. The thyroid hormone plays a direct role in how the body builds and breaks down bone tissue. In the right amount, it supports a healthy balance between the cells that build bone and the cells that break it down. Too much thyroid hormone, even slightly too much, sustained over years, and that balance tips. The cells that break down bone become more active than the cells that build it. The body is remodeling bone faster than it can replace it. Over years, this accelerates bone loss in ways that do not produce any obvious symptoms until significant damage has already occurred. The FDA label states directly that decreased bone mineral density is a serious side effect that has been reported with levothyroxine. A study examining long-term users found that women taking higher doses had significantly lower bone mineral density at the hip, the spine, and the wrist, compared to women not on the medication. The mean duration of therapy in that study was more than 20 years. The same study found higher rates of femur fractures in long-term users. Postmenopausal women are identified specifically as a higher risk group, and the reason is straightforward. Menopause already reduces the estrogen that helps protect bone density. Add slightly elevated thyroid hormone from a dose that has not been rechecked, and two separate forces are pulling bone density in the same direction at the same time. The bone loss is silent, no pain, no warning sign, no obvious symptom, until a fall that should have caused a bruise causes a fracture instead. Beyond bones in the heart, the label lists something worth reading carefully. It states that the consequences of incorrect dosing include effects on cognitive function and emotional state, memory, concentration, mood stability. A dose that has been slightly too high for years without anyone noticing can contribute to anxiety that feels unexplained, irritability that comes without clear cause, and difficulty sleeping that sleep hygiene alone cannot fix. The body's running slightly too fast, like an engine with too much fuel. Everything is slightly revved up, and over time, that takes a toll. A dose that has been slightly too low, which research suggests affects up to 10% of chronic users, produces the opposite picture entirely. Fatigue that does not lift no matter how much sleep someone gets. A brain that feels slower than it used to. Depression that does not respond well to treatment because the underlying thyroid level is never quite right. Weight that accumulates despite reasonable diet and exercise. Both directions cause real, measurable harm to daily life. And both can go completely undetected for years when the monitoring appointments happen less frequently than they should. The label recommends checking thyroid levels every 6 to 12 months once the optimal dose has been established. In practice, many long-term users go years between checks. Their dose does not change. Their prescription renews automatically, and the body quietly drifts in one direction or the other without anyone looking. None of this means levothyroxine should be avoided. For true hypothyroidism, it is necessary. There is no alternative. The thyroid does not recover. The hormone must come from somewhere. What it means is that being on this medication for life is not the same as being on a stable, unchanging, perfectly calibrated dose for life. The body changes over time in ways that affect how the medication works. Weight changes alter the dose needed. Age changes how the body absorbs and uses the hormone. Other medications introduced over the years can interfere with levothyroxine absorption. Antacids, calcium supplements, iron supplements, and several others are documented to reduce how much levothyroxine actually enters the bloodstream when taken too close together. And the dose that was right in the first year of treatment may be meaningfully different from what the body actually needs 10 or 20 years later. For bone protection, research supports adequate calcium citrate and vitamin D intake for long-term levothyroxine users, particularly postmenopausal women. Weight-bearing exercise is commonly discussed as one of the most supported lifestyle approaches for maintaining bone density alongside medication. Many doctors recommend a bone density scan for postmenopausal women who have been on levothyroxine for more than 5 years, particularly those on higher doses. For heart health, many doctors recommend a TSH test at least once a year to verify the dose remains in the correct range and has not quietly drifted into overtreatment. And the questions worth bringing to the next appointment. When was my TSH last tested? And was the result in the optimal range, not just technically normal? Has my dose been reviewed given any changes in my weight, age, or other medications I have started? Has my bone density ever been measured? Am I taking anything that might be reducing how well this medication absorbs? These are not difficult questions. They are the questions of someone who understands that forever is a long time, and that a pill taken every single day for decades deserves ongoing, active attention. Here is the truth about levothyroxine. It is necessary, it is effective. For people whose thyroid cannot do its job, it does that job instead, every single day. But it has a narrow window between too much and too little, and a window that is even slightly off, sustained over years, over decades, quietly affects the two systems most people cannot afford to lose: the bones that hold the body together and the heart that keeps it running, the cognitive function that makes daily life meaningful. That is not a reason to stop taking it. It is a reason to pay attention, to ask questions, to make sure the dose that was set years ago still fits the body that exists today. It is in the label. It has always been there. You just needed someone to read it out loud.